That's perfect. Let me introduce myself. I'm Dr. Sumbal, mrcog mentor, and I have been mentoring many mrcog aspirants who successfully achieved their goals, and I'm really happy to be here with you today. So, welcome everyone. How's everyone doing? That's wonderful. And how's your preparation is going so far? Why is that so? Why you can't manage the time for your studies? Yeah, persistence is the key. If you are trying and you're not taking any break, then definitely you will achieve your goal. If you are trying, that's a good sign. Well, remember, the MRCOG journey may seem tough at times, but with the right strategy and consistency, success is always possible. And many of my students have achieved it, and you can too. So trust yourself and trust the process. And yes, the most importantly, trust your hard work. So let me introduce today's session without wasting any further time. I have divided it into two parts. In the first part, I will guide you step by step and on how to book the MRCG Part 1 exam. And in the second part, since September is the Global PCOS Awareness Month, so I have chosen this topic particularly. Um, this will not only help in your exam preparation, but also give you a practical knowledge for your managing your patients in the clinical practice. So stay tuned. Here I have shown the exam calendar for January 2026. As I believe you have already got your eligibility done by RCOG and you have successfully submitted your expression of interest. Is that right? Please do let me know all of you have passed these steps. Because if you have done this eligibility step and the expression of interest, then this session would be fruitful for you. That's great. So as you can see here on this slide, the booking window application opens on 21st of October 2025. This is the date you need to remember because uh, since we all have the busy schedule and sometimes we just miss the date. And if you miss this date, then unfortunately you will miss your slot. So remember 21st October is the date for the booking window application opening. Here I have shared the slide for the exam fees. You must check your banding, like which country falls into which band, and according to that, your fee would be decided. For instance, for India or Pakistan or Bangladesh, that falls in band B. For for band B countries, the fee would be £572. But here's an exceptional point. The RCG has updated this note on the updates on Part 1 and Part 2 exam fees for candidates who are booking their exam in India. So this slide is classically for the students or for the aspirants who are booking their exam in India. Since there is an increase in the GST tax, so the fee for the India would be an additional of £103. So your total fee would be £675. Is everyone with me? So this is classically for the Indian candidates. I'm repeating this again. The candidates who are planning or booking the exam in India, since India falls in band B, but due to the increase in the tax, they need to pay an extra amount of £103. Am I clear? Anyone from India here? So you need to save 675 pounds. So let's move on. Booking is the very first step towards your MRCOG journey, and it needs to be done correctly. Many candidates underestimate how quickly centers fill up. And there are some common mistakes, including forgetting to reset the password, waiting too long and losing their preferred center, or even entering the wrong details during the checkout. So these are some common pitfalls mostly candidates do, but don't worry, I'm here to address all of these. And today I will walk you through a simple step-by-step process so you can book your confidently and avoid these pitfalls. So this is a summary. I hope everyone can see the screen. Yes, Nayab, there is no tax in Pakistan, so your fee would be 572 pounds. This is only for the Indian candidates. Okay, so listen carefully. Here is a summary of all the steps you need to follow one by one. First thing first, on the exam booking day, you will get an email, maybe one day before the exam booking opening. You will get an email by the RCOG. So be careful, you need to check your email regularly so that you won't miss this email, because this is the email which will ultimately lead you to towards your exam booking. Then on the second step, you need to click on the candidate exam portal, and the link was provided will be provided into your email. Once you click that exam candidate exam portal, there would be a window shown on your screen which says reset password. And now I will show you one by one all the pictures. Just for now, just listen carefully what steps you need to follow. Then once you reset your password, then you need to log in again. And once you log in into your candidate exam portal, you will see a dashboard in front of you, and there you can select your exam centers. And finally, step by step, you will check out, pay your fee, and and then ultimately you will get your confirmation email by the RCOG, which says that you have successfully booked the slot at particular center. Walaikum Salam, Safi Azim. Currently, I'm not teaching to anyone. I have my own very busy schedule these days. So that's why I just took a break from teaching. Okay, coming back to our exam booking steps. Again, eligible candidates have been sent an email confirming the booking window opening. And in that email includes a link to the RCOG candidate exam portal. Once you click that portal, follow the link to the portal and create a password specifically for this platform. That means this password is classically for your RCOG candidate exam portal. It has nothing to do with your previous passwords. This password is solely for accessing the exam portal and is not linked to your RCG website login. That means the password and the email address you use for making your RCG account on their website, that particular password has nothing to do with your this password. This password would be new. Pulumi, you may expect the email maybe 1 or 2 days prior to the exam booking opening date, or maybe sometimes they just send you at the time of when the seats would announced. Yes, Snap, don't worry. I will show you the email and how you can reset. So I was talking about the steps you need to follow for in order to smoothly book your MRCG Part 1 exam. So let me recap all the steps again. So first of all, you need to open up the email which is sent to you by the RCOG, and in that email you will provided with an candidate exam portal link. And once you click on that link, there would be a window open in front of you which says that create a password. You need to log in, you need to reset your password. And once you log in into your candidate exam portal, you will have a dashboard in front of you. And there you can easily select the center of your choice. And then you need to pay the exam fee and ultimately check out. And once you check out from your exam booking portal, you will get a confirmation email by the RCAG. So let me take you through one by one. So this is how your email, which is sent to you by the RCOG, would be look like. Is everyone with me? If you had any question, if you were not able to understand any step, don't hesitate to ask me. Okay, so here you can see this is the RCOG candidate exam portal. And once you click on that, it would the next window would be look like this. So here you can see in this block, you need to enter your email address. And please note, this is the same email address you used for making RCOG website account. Am I clear? Your email address would remain the same. The email address you used to make your account on the RCOG website, you need to enter the same email address here. Okay. And since you are booking your exam for the first time, you need to click here, which says first time users. So here on this point, you need to click so that you can reset your password. Okay, after clicking on the click here to set password, you will be taken to the next page. And this is how it would be look like. You will get another email which says the reset your password. And once you click here, this this window would be open. You need to enter your email address, click on the reset password button, and now this is how your dashboard would be look like. So first-time users and existing users can use this form to set or change a password. So here you can enter your new password and then re-enter the same password and then click on set your password. So this is it. So this is all about logging into your candidate exam portal. Click the link provided in the email to access the page for setting your password. And this is the link we are talking about. Your password should be a minimum of 6 characters long and include at least one punctuation character and one number. So these are the punctuation characters. You need to involve one of these into your password. Am I clear? If anyone have any confusion, you may ask me. Okay, so once you log in into your candidate exam portal, this is how it looks like. Okay, Nayab, if you don't remember your, well, it is not possible that you do not have any RCOG account because that is mandatory if you want to apply for the eligibility. Because once you apply, once you make your RCOG account on their website, they will send you your school ID, which you used for your eligibility form. Is that making sense to you?
Ma'am, I never said that I don't have an RCOG account, but I don't remember exactly because I applied the eligibility like a year back and I received the eligibility mail. After that, I just applied for expression of interest and that was just clicking on the website and they sent me um, just a message, not even mail for expression of interest. So what should I do to resume my account or what should I do? I actually don't understand because
Okay,
first we have password before resetting.
Okay, that's a very simple way to resolve this issue. First of all, please tell me, do you remember your email ID?
Yes, ma'am, I regularly get mails from RCOG.
So there is nothing to worry about. That means you are registered and your email ID is the same ID. And now when you are making your account, you're resetting your password into a candidate exam portal, you just need to remember that email ID. That's it. You will automatically, since you are eligible and you have successfully submitted the expression of interest, you will automatically get this email by the RCG once the booking window opens. And once you get that email, you just need to simply follow these steps, which I have already explained you. This email, you will definitely get this email since you are registered. I hope I made my point clear. So let me just recap for the candidates who just joined us. We are talking about the steps we need to follow in order to book your MRCG1 exam smoothly. So first of all, you will get an email by the RCOG in which they would provide you with the link of RCOG candidate exam portal, and you need to click on this link. Once you click on this link, this window would appear on your screen, and here on the first time users you need to click here, and once you click here it would lead you to reset the password. So you might get a link. They might give you maybe a temporary password to enter here, or once you click here, the next window would appear like this. And here now you can enter the password of your choice, then re-enter your password. Make sure your password should be a minimum of 6 characters, and it should involve punctuation characters like these. And once you set your password, then automatically you will log in into your candidate exam portal. And once you are here, you will see the welcome note over here. On the left side, you can see here it says exam bookings. Now, your task is to go here on the exam bookings. And if you have got your eligibility, if you have successfully submitted your expression of interest, this will show on your dashboard, which says pre-approved exams. That means you are approved to sit in the MRCOG Part 1 exam, and you just simply need to click here. And once you click here, a window would come which says the policies of the RCOG. You just, if you have time, you can read them thoroughly and move on to the accept button. And once you accept that, the different exam locations would appear on your screen. And classically, these exam centers are based on the location you have provided on your eligibility form. For instance, if someone has mentioned their address, if they are from Pakistan, and in particularly from Pakistan, they are from Lahore, then in these exam centers, they would recommend the areas which are nearest to the Lahore or maybe in the Lahore. If there are 3 exam centers in the Lahore, they will show all the exam centers. And similarly, maybe the areas around Lahore, it could be maybe Sialkot, Gujranwala, or any cities which are closer to Lahore. So on the safe side, you might you may choose 3 nearby centers just in case if the center of your choice has no slot available, then you can go. You have some backup option to choose the second center or the third center maybe. Is everyone with me?
Ma'am, when will we get this email?
Uh, you might get this email 2 days before the booking window opens, or maybe on the day of when the seats were announced. So it varies from person to person. Some candidates may receive this email maybe 3 days before. Okay, so select the exam center. After selecting a center, available dates and time should appear. I will show you the slide how it's gonna look like. For instance, if you can see here, If I click on this exam center, automatically on the right lower corner, I will see the calendar and the time of the exam venue. So automatically, once I click on the exam center, I will choose the date, I will choose the time, and then I would finalize that exam center. So this is how it's gonna work. If no appointments are shown, it indicates that your chosen test center is fully booked or unavailable. RCG does not have exclusive access to the Pearson View centers. Other exams may be scheduled simultaneously, limiting available slots. So here's a tip. If you have the option, try to choose some mainstream centers. Like you may go and choose exam centers which are located in the bigger cities as compared to the smaller or the newer centers. Because sometimes it happens, I have seen this from the last 2 years. Many candidates who have booked their exam in the peripheral areas or some remote Pearson centers or the new Pearson centers. A month later, they got the email from the RCU, from the Pearson, that the exam center has been cancelled. So if you have the option, try to choose the centers which are old centers or the centers who are located in the bigger cities or who are not located remotely. Did you get my point? Because I have seen many candidates who just wasted their, unfortunately, their whole year was wasted, or the 6 months were wasted just because of this Pearson Center issue. So try to be on the safer side. Okay, if you have selected multiple centers, you can easily switch between them to check availability. Click on to the dot next to each center to view its availability. If your chosen test center still has availability, click on the desired date, then select your preferred time slot. So here it goes. For instance, this is an exam center in the UK. And once I click on here, I can see the exam calendar and the time slots here down bottom. So there might be exams conducting 3 times a day. So whatever time suits to you, maybe 10 a.m., 12 p.m., 2 p.m., or so on, you can simply select the time. And once you select the time and your exam date, then the next step would be your payment method. And here, what usually happens, uh, some of the candidates, they are not sure that their card is valid, their bank card is valid for the international payment. So in order to make this payment, your card should be eligible for the international transaction. So this is a very important thing you need to keep in your mind. And the second thing, you should have sufficient funds in your account. For instance, if you are paying from a local bank, then definitely there would be some tax deduction there. So you should have some extra money in your account. Otherwise your payment would not be proceeded. So make sure you enter the right card details, your correct number, your correct code, and everything, and then proceed to the payment. And once your payment is done, you will get an email by the RCG of the confirmation of your exam. So these are the steps. If anyone have any question, or if you are confused in any step, you may ask me.
Ma'am, I have two questions.
Yes.
Ma'am, the first question is regarding the payment. Like, can you please tell me in thousands, like how many extra money should one have if he or she is paying from a local bank?
Well, the tax deduction would be different in every year, but at least you should have, if I talk about in PKR, you should at least have 20,000 PKR extra in your account, minimum.
Thank you, ma'am. Thank you. And ma'am, the second question is, if you go back to the very first slide where it was mentioned like email and then password and then applying for the first time user. Ma'am, I just want to ask that after entering the email, yes, ma'am, it is. After entering the email, should we have to enter the password and login, or will just click on this click here?
Okay. Initially, there is no need to enter the email address or the password here. Initially, you just simply go here for the first time users. Once you reset your password, then this block will appear again, and then you need to enter your email address and your new password, which you just have reset. What I did
Uh,
when I was taking the exam, I did the exactly same mistake. I just entered my email address here, and I used my previous password, which I used to make my RCG website. I just entered here, login, and honestly, I wasted a lot of my time here. And then I just calmed down myself, and I look at here. Then I try to reset my password. And another mistake what I did here, I just frequently clicked on this link. Why? Because at that very day, when since everyone is booking the exam, the system is a bit slows down. You might do not get this email immediately. So I had no patience at that time. I was panicked. I was nervous. So I literally I clicked here 8 to 9 times. And ultimately, what happens? I After 2 to 3 hours, I received 9 new passwords, and all of them were not valid. So these are the little things you do. These are the little mistakes you do when you are panicked and when you have no guidance. So don't repeat my mistake. Be patient and don't panic at this time, because if your system is is not working fine, that means everyone's facing the same thing. So everyone would be on the same page. If you face any technical error, definitely there would be another candidate who is facing the same technical error. So be patient. Once you open this, click here. Then everything is pre-guided. And honestly, now it seems like a complex process, but once you do it by yourself, it would be very straightforward.
Ma'am Sumbal, what would be the time frame for the login and submission of fee when we get the email from RCOG?
Okay, it depends. Last time I remember, usually it's 2 p.m. PST time, or it could be 8 p.m. PST time. But whenever the seats would be announced, you will get an email. So don't worry about that. Any other question? Okay, let me give you some tips. Be prepared. Have all necessary information and documents ready, including your ID and payment details. Particularly your payment details. Your card should be ready. Set a reminder. Use phone or calendar reminder for the booking date and time. Check your email regularly. This is very important. And sometimes these emails do not come into your inbox, so you need to check your spam folder as well. Log in early. Have some backup option. For instance, if you have some your any center of choice, but make sure you have some backup option as well. For instance, if you are willing to sit in the exam in the Pearson Center of Lahore, then please have some backup option as well, that you might travel to Faisalabad or maybe to Gujranwala. So have some options in your mind. Then double check your details once you filled everything. Once you book your exam slot, make sure the center is correct, the time is correct, and then when you enter your card details, make sure everything is correct so that no extra time would be wasted. Stay calm. Uh, then you might take time off from your work if that is clashing between your working hours and the exam booking announcement. So you might take an off from your work. Uh, for your convenience, you also set your time to the UK time. Maybe you may add the extra time in your. Um, uh, I have this option in my phone that I can add multiple times of different countries. So if you have that option in your mobile phone, you can also do that. Make sure your internet must be working fine. It should be high speed so that no more time is wasted. Have a backup internet plan as well. You might also set some alarm. So these are the tips. which might be helpful on the exam booking date. But the most importantly, what is, if I talk about from my personal experience, you should be just relaxed. You should have some patience, and there is no need to panic around. Okay, so there are some don'ts. Don't use the same password for the next exam portal. If you forget your password, don't keep clicking like crazy the way I did. It won't magically remember it for you. So you may chat with your bank before your booking if your account can handle the international transaction and what is the limit of your card. Check your bank balance, double check those bank details. Don't panic or rush during the booking process, and don't assume that slot availability. Have some backups and try to book your exam as early as possible because these seats like immediately sold out. So conclusion is following these steps ensures hassle-free booking. You need to stay updated with the RCOG emails and best of luck for your MRCOG Part 1 exam booking. So again, if anyone have any confusion, if you are lagging behind or you are just confused about any step, you may ask me.
Sorry, ma'am, I'm disturbing you again and again.
No
Ma'am,
problem.
yes, ma'am. I have just another question. Just in the previous slide, there was mentioned that we have to sort out our issues regarding RCOG login well before the booking date and time. So that's the question I asked you, that because I don't remember exactly my RCOG password or account. So what steps should I take to resolve this issue or to find out my RCOG account so that I
Okay,
may
you
not
just
miss out the booking?
okay, I got your question. You just for this step, you just need to remember your email address. That's it. Okay, if you are really concerned about your password of the RCOG website, there is an easy step you can follow. Go on the RCOG website, click on the login section, uh, and there you can see the option of reset password or forget password. And that is very simple. You can just reset your password of your RCOG website. But for this step, you don't need that password. That has no significance in your candidate exam portal login. Are you clear now?
Yes, ma'am. Thank you.
Welcome. Yes, Dr. Amna, you can make your payment from any card. Maybe you might take help from your friend, or you might take help from some of your family member or cousin or anyone who lives in the UK. They can make a payment on your behalf. So in that way, you might save some money from the tax.
Ma'am, if we do payment from UK, so we will not get cutting on the tax. We will not get any
Yes,
tax.
yeah, definitely. Because that would be a local payment, so there would be no tax.
Okay, thank you, ma'am.
Welcome. Any other questions? No, Polmi, the password which was written there in eligibility email, you don't need that password. Yes, that is the password for your RCG website, right? But that password do not required in your candidate exam portal. This password would be different. So don't use that password here as I did. Yes, Safia, you will book your exam slot first, and at the last step, you will pay your fee. Shall we begin with our teaching session?
Ma'am, we have another session on anatomy. So in premium schedule. So should we continue or
Okay, you might. Okay, is that scheduled today?
Ma'am, in according to the Pakistan Standard Time, just 5 minutes after that.
Okay, you might leave this session. You will later on get the recording and you can watch whenever you have time. Okay, since September is Polycystic Ovary Syndrome Awareness Month, so I choose to teach this topic so that it might help you in your clinical practice as well. So let me share you some background. PCOS, polycystic ovary syndrome, is the most common endocrinopathy affecting reproductive aged women with an estimated prevalence of 8 to 13%. It is responsible for 80% of all cases of anovulatory subfertility. Ultrasound evidence of PCOS is seen in 20 to 30% of women, which also means that if on the ultrasound you don't find polycystic ovaries, that doesn't exclude the PCOS. Because in only 20 to 30% of women, we can classically see the multiple cysts forming inside the ovaries. However, it holds some significance. Uh, why PCOS holds so much significance in gynecology these days? Because with every passing days, we have been encountering more and more subfertility cases in the reproductive age women, and that is classically an ovulatory subfertility. That means the females are not able to ovulate properly, and that leads to subfertility. And it is 80% of the cases in the reproductive age, which is very, very huge and alarming. So that's why we are trying to make some awareness among the clinical clinicians and as well as the general population so that we can decrease this number. Since we are studying the disorder of the ovaries, so it is important we should know that what is the WHO classification of ovulatory disorders. I would classically focus on the WHO type 2. However, in summary, we have classically three types of ovulation disorder. One is the type 1, type 2, and type 3. What is type 1? That in the type 1, there would be hypogonadotrophic, hypoestrogenic type, which means hypogonadotropic means the hormone is not coming from the higher centers like hypothalamus or pituitary, which ultimately leads to the low production of estrogen or androgens. The classic example of the group 1 is, which is classically due to the hypothalamic pituitary failure, is Kalman syndrome, Sheehan syndrome, idiopathic GnRH deficiency, or stress or exercise induced amenorrhea, or it could be due to pituitary tumors. That means in group 1, classically the problem is with the high centers. It could be due to no gonadotropin releasing hormone from hypothalamus. Maybe problem is at pituitary level, which is not able to produce follicle stimulating hormone or luteinizing hormone. And ultimately, if those higher hormones are not there, the ovaries are not able to produce the estrogen. So that's why it is known as hypogonadotropic hypoestrogenic type. So this is the category, your first category. Why I'm teaching you this? Because in your exam, they might give you a scenario and you need to identify, is it hypogonadotropic, it is normogonadotropic type, or it is hypergonadotropic type. So you should know these examples that Kalman, Sheehan, stress-induced or pituitary tumors, all of these lead to type 1 ovulatory disorder. Am I clear? Then WHO type 2, it is normogonadotropic. As its name indicates that the gonadotropin releasing hormone, follicle stimulating hormone, and LH, they are comparatively normal. And also the estrogen level is also normal. But still, the female is experiencing ovulatory issues. She is not ovulating well. And classical example here is polycystic ovary syndrome. So if in your exam they will ask you in which WHO category of ovulatory disorder PCOS falls, so what would be your answer? Please tell me in the chat box. PCOS is the example of which ovulatory disorder of according to WHO classification. Is it type 1, type 2 or type 3? Yes, it is type 2. And again, it is normogonadotropic, normoestrogenic. That means hypothalamus is working fine, pituitary gland is working fine, ovaries are pathologically fine. Estrogen is, yes, it is there, but still the female is experiencing ovulatory problem. Then the type 3 is hypergonadotropic, hypoestrogenic. That means hypergonadotropic means there is excessive amount of GnRH or maybe FSH or LH, but still there is low amount of estrogen in the body. And the classical example is primary ovarian insufficiency or premature ovarian failure. So whenever the word comes into your mind, whenever you see the word premature ovarian failure, that means the higher centers are working absolutely fine. Even there might be an excessive level of GnRH when you assess this woman, but still she is not ovulating. So that is premature ovarian failure. It could be seen in gonadal dysgenesis like Turner syndrome or fragile X premutation carriers. So this is a summary of ovulatory disorders. You need to have some idea because there could be some questions in your exam. Um, there might be different clinical scenarios and you need to identify which type it is. And where, or maybe they will give you a scenario and ask you, where is the problem? Is it at the higher levels or is it the problem with the ovaries? Dr. Sophia, I will tell you in a while why there is a problem in type 2. Because today we are going to study PCOS in detail. So what is polycystic ovary syndrome? Okay, there is another term, PCOD, polycystic ovarian disorder. Does anybody have any idea what is the difference between polycystic ovary syndrome and polycystic ovary disorder? Please do let me know in the chat box. Well, let me tell you, there is no difference between PCOS and PCOD. Yes, initially they would consider as a different diseases. Uh, Initially, the physicians they used to diagnose PCOS in the different patient and PCOD with the different patients. But now these days, both terms are used synonymously. That means PCOS is equivalent to PCOD. So these days there is no difference. You can use these terms interchangeably. Okay, what is this condition? It is a condition in which the ovaries produce an abnormal amount of androgens, primarily testosterone, which is a male sex hormone, that are usually present in women in small amounts. And it is the commonest cause of anevolution and a leading cause of infertility or subfertility, you may say. So here you can see in this diagram, this is how a normal ovary looks like, how the folliculogenesis is going on, and here you can see how the secondary oocyte is going to come out from the ovary at the time of ovulation. But in polycystic ovary, you can see how there are multiple immature follicles and there is no ovulation you can see. The pathogenesis of PCOS is not well understood and thought to be multifactorial. I will come back to this slide. First, I think I need to explain you the pathophysiology behind the PCOS. And this was the question which Dr. Safia has asked me. So again, it is the most common endocrinopathy in the females of the reproductive age. So basically, the mechanism behind the PCOS is not well understood. However, some evidence suggests that there is involvement of hypothalamus pituitary ovarian axis. Normally, what happens, as you can see here in this diagram, we have the candidates who took my endocrinology lecture. I used to say that whenever you are studying endocrinology, you need to start from the higher centers. You need to, if you understand the hypothalamic pituitary or ovarian axis, then if you know the normal mechanisms, then you can easily figure out where is something wrong, right? So let me tell you how the normally hypothalamic pituitary ovarian axis works. So what happens? Hypothalamus, yes, we know hypothalamus is responsible for the production of gonadotropin releasing hormone. Once this hormone gets released, it acts on anterior pituitary, and under the influence of G and RH, anterior pituitary produces two major hormones, which is luteinizing hormone and follicle stimulating hormone. These two hormones then go and act on the ovaries. And since you have been preparing for the exam, someone out there can answer my question: where does exactly follicle stimulating hormone acts on the ovaries, and what is their function in terms of hormonal synthesis? Or let me simplify the question from exactly, please tell me, from which part of the ovary the estrogen is being synthesized. Because if you know these, then you would be able to manage this condition. Yes, excellent, Dr. Nayab. Granulosa cells. Why granulosa cells? Because they have aromatase enzyme, which converts the androgens into estrogen. So what happens? These hormones act on ovaries, then androgens are being produced. One theory suggests that in PCOS, the key feature is excess androgen. And from where does these excess androgens comes from? The theory which suggests that there might be rapid pulsing from the hypothalamus begins. Since there is a rapid pulsing from the hypothalamus, then Okay, so I was talking about a proposed mechanism is that hypothalamus produces rapid pulses of gonadotropin releasing hormone. If there is more and more gonadotropin releasing hormone, that absolutely makes sense. It would lead to increased production of luteinizing hormone and follicle stimulating hormone. But in this particular case, luteinizing hormone would be way more in excess than follicle stimulating hormone. And why is that so? Because naturally, gonadotropin releasing hormone has more tendency towards luteinizing hormone. One is this reason, and the second one is the estrogen has some negative feedback effect on follicle stimulating hormone that doesn't allow follicle stimulating hormone to become in excess amount. So that's the reason in polycystic ovary syndrome, we see the more ratio of luteinizing hormone as compared to follicle stimulating hormone, which acts on ovaries and adrenal glands, because of which leads to androgen production. Normally, when there was a sufficient amount of luteinizing hormone and follicle stimulating hormone, yes, the androgens were being produced, but they are not in a plenty amount. But in this particular case, since we have rapid pulses from the hypothalamus, we have more gonadotropin releasing hormone, we have luteinizing hormone and more follicle stimulating hormone, which leads to excess androgen production, which is the culprit here in this condition. At the same time, these androgens makes the adrenal glands more sensitive to ACTH, which leads to another production of more and more androgens. So this was about the hypothalamic pituitary ovarian adrenal axis. But what is happening on the other side? These androgens, these causes the insulin resistance. And what is insulin resistance? It is simply means the muscles or the tissues they are no more reactive towards the insulin. As a result of that, more and more insulin is being produced to carry out the proper function. Since there is a resistance from the tissue and more insulin is required to produce a proper action, there would be increased level of insulin in the blood, which is known as hyperinsulinemia. Is everyone with me till now? This is important if you understand the pathophysiology of polycystic ovary syndrome, then you are in a better position to manage this condition. Okay, for now, yes, the androgens are the main culprit in PCOS. What happens on the other side? It leads to an insulin resistance, and since there is insulin resistance in the tissues, more insulin is required to carry out their proper function, and which leads to hyperinsulinemia. This hyperinsulinemia further stimulates the ovary to produce more and more androgen. So you can see this is a vicious cycle. Androgens leading to insulin resistance, and this hyperinsulinemia further stimulates the androgen production. So this is a vicious cycle, and that's why the patients who have PCOS, they just ultimately have weight gain. Then insulin, another bad event happened, which is insulin also reduces sex hormone binding globulin. And in the endocrinology, there are some rules. There are some rule of thumbs you need to crystal clear about that. Whenever we use the term binding globulin, these are the proteins which are synthesized by the liver. And what is the function of these binding globulins? That they bound the excess amount of the hormone, whatever the type of hormone in the body, and make them physiologically deactive. So the only amount of hormone which is present in the free form in the blood is only capable of producing the physiological effect. Since here you can see insulin reduces sex hormone binding globulin, which is produced by the liver. So what do you think? Would be more and more free androgens would be available in the body, or there would be less amount of androgens floating in your blood? So what do you think? If there is less amount of sex hormone binding globulin, what would be happen to the androgen? Yes, there would be more and more free androgens. So you can see how bad is this vicious cycle, and how the excess amount of androgens disturb so many physiological functions of the body. So yeah, so this is all about the PCOS. Now here it could be normogonadotropic, normoestrogenic, but at the same time there are excessive amount of androgens which lead to insulin resistance, which might lead to an ovulation as well. And they could be now. If you understand the pathophysiology, now we can go and look at the symptomatology of this condition. So what are the possibilities of the symptoms? Androgens, let's begin from that. If a female have more amount of androgens, then classically it produces more amount of testosterone. So what could be the symptoms? There could be acne oily skin, excessive hair on the face or body. There could be male pattern baldness or hair thinning. So these are the symptoms of hyperandrogenism. Then they could be due to hormonal imbalance. They could be heavy, long, intermittent, or unpredictable or absent periods. Due to insulin resistance, there could be weight gain, especially around the belly. And due to an ovulation, since there is no proper ovulation happening in PCOS, it could lead to infertility. So these are the symptoms. In summary, what could be the common symptoms? Irregular periods, acne, hirsutism, skin darkening could be there, unhealthy weight gain, baldness, headache. People with PCOS are more likely to have other health conditions, including type 2 diabetes, hypertension, high cholesterol, heart disease, and endometrial cancer. Why these are important to look into? Because when you are managing the patient of PCOS, you need to take a proper history. You need to ask her that do you have any family history of diabetes? Because later on in her life, she might have this condition. She could have, since she's already having insulin resistance, so the chances could be more that she might develop type 2 diabetes, or already she had those genes which make her predisposed to this condition. Maybe if she do not have type 2 diabetes in her family history, so she might not have PCOS at first place. Then hypertension, high cholesterol, heart disease, endometrial cancer. Why? It is okay. These are the long-term complications of PCOS, because later in life, this patient might have type 2 diabetes, hypertension, hypercholesterolemia, heart disease, endometrial cancer. Why endometrial cancer? Because if there is hormonal irregulation, they could be disturbed menstrual cycle. They could be little or no bleeding for a very long period of time. So that would ultimately lead to endometrial thickening and into endometrial cancer, which is a very serious long-term complication of PCOS. On the other hand, apart from these symptoms, the important thing to understand is that PCOS can also cause psychosocial effects on the patient. It might cause anxiety, depression, negative body image, which seems like very simple words, but these affect hugely on the patient, because sometimes the patient might come to you not because of infertility, not because she is not having regular cycles, but yes, definitely she might come due to negative body image. She might come to you that I have this acne, I have this facial hair, I have this obesity, and I don't feel comfortable in my body. So this is the biggest challenge. You need also, since you are prescribing her medicine, but you need to address her psychosocial aspect as well. Similarly, if a patient who has PCOS and she has infertility, she also she must have some psychosocial effect as well. So you need to understand the stigmas of the patient and then manage them accordingly. How would you, the next step is, now we know the pathophysiology, we know what are the symptoms, but now how are you going to investigate PCOS? Usually we can offer and just assess the patient on the basis of the clinical findings, but if you want to investigate further, you can order luteinizing hormone 2 and follicle stimulating hormone levels, which classically order on the day 2 to 5 of the menstrual cycle to see the hormonal balance. Then the other investigation you can follow, thyroid function test, because sometimes hyper or hypothyroidism may present with such symptoms. So you need to exclude that. Serum prolactin level. You might also test testosterone level. OGTT. Why OGTT? Please tell me why we are advising this patient to get an OGTT test. Why? Yes, if you want to establish insulin resistance, you need to order oral glucose tolerance test. This is for not too prone to diabetes mellitus. We For diabetes mellitus we can offer HbA1c2, but classically here we want to establish insulin resistance. So for that, we order OGTT test. No, for insulin resistance, we offer OGTT. Okay, then serum hormone binding globulin. Yes, if you are not sure about your diagnosis, then yes, you can go with the sex hormone binding globulin test to calculate pre-androgen index. Then, in a broader picture, if you want to exclude other causes of hirsutism or primary amenorrhea, you may also advise 17-hydroxyprogesterone to rule out 21-hydroxylase deficiency and anti-Mullerian hormone. Okay, classically in the guidelines, they say we offer anti-Mullerian hormone test if we are not going to order it, if we are not going to do ultrasound scan. So if you have the option of ultrasound, you can do that. If not, then you can also test anti-Mullerian hormone. If clinical or biochemical hyperandrogenism is detected, check serum, DHEAS, and androstenedione. These are the androgens. You may need to exclude other causes of secondary amenorrhea as well. Then pelvic ultrasound in those for more than 8 years past menarche. What does that mean? That means if a female comes to your clinic and she is just 1 year past menarche, so you cannot simply go with the diagnosis of PCOS, because in that case, maybe 1 year past menarche, she might not be ovulating till now, because sometimes after menarche it might take 2 to 3 years to start proper ovulation, so it might give you the false finding. So that's why I just avoid the diagnosis of PCOS on the basis of ultrasound in within less than 8 years of past menarche. So that would not give you a proper finding. Okay, so these were the investigations, but how you gonna diagnose? How you will establish your diagnosis of PCOS? So classically, for the diagnosis of PCOS, we use this criteria, which is Rotterdam criteria for diagnosis of PCOS. We have three elements in this criteria, and in adults, if two out of these three criteria are there, then you can establish your diagnosis. And what are these three criteria? One, your patient should have irregular periods. On the scan, you will find multiple cysts. And thirdly is the high androgen level. That means the patient may have the symptoms of hyperandrogenism like hirsutism, weight gain, acne, hair thinning, or hair fall, male pattern baldness. So these symptoms should be there. So out of these three, for instance, if your patient is having irregular cycle and she has hirsutism, so would you establish the diagnosis of PCOS? Yes or no? The scan says there are no multiple cysts.
Can you repeat the question, please?
Okay, let me give you a scenario. There is a female who comes to your clinic and she is 24 years old. She is unmarried and she presented to you with the irregular periods, and she also complains about the facial hair on her face. There are excessive facial hair on her chin, and then she also complains about the excessive hair fall these days. You offered a pelvic ultrasound, but the ultrasound says there are no cysts in the ovaries. So what could be your diagnosis here?
Polycystic ovarian syndrome.
Yes, exactly. So the point here is that in young women, an adult female, if the two out of three criteria are met, even the ultrasound is normal, and she is having irregular periods and symptoms of hyperandrogenism, your diagnosis would be PCOS. Yes. Okay, so again, irregular or absent ovulation, clinical or biochemical signs of hyperandrogenism. You can see here clinical or biochemical sign. The patient may have hirsutism, all the clinical signs of hyperandrogenism, and when you investigate her hormonal profile, that came back normal. So if there are symptoms, you need to consider those symptoms. It could be acne, hirsutism, alopecia. Then polycystic ovaries on the pelvic ultrasound, the criteria is 12 or more than 12 antral follicles, or ovarian volume should be more than 10 ml in one or more ovary. So this is the criteria for establishing the diagnosis of PCOS. So you can see there's a lot of variety. The symptoms vary from person to person. Some may have just a very classical finding on the scan, but they don't show much symptoms of hyperandrogenism. And one important thing, it should be happen in the normal weight female. So usually what happens, we usually consider due to insulin resistance, the important sign of PCOS should be obesity. But it is not always this is the case, because in lean patients, PCOS could also happen, which is known as lean PCOS. So weight doesn't exclude PCOS. So this is the radiological finding. You can see here, this is a very good diagram, very good graph picture. Here you can see this is the ovary and these are the antral follicles, and you can see how multiple they are. There are many, and you can see how they are appeared as a ring appearance. They are located adjacent in the peripheral area of the ovaries. That's why we call them the antral follicles. And this is a classical sign you see on the ultrasound. Is it, all of you can see this picture clearly?
Yes, ma'am.
Okay, now you diagnosed your patient. Now the next challenge is how you are going to manage your patient. So there could be many challenges. It depends on patient to patient. But in a nutshell, the goal of management would be, if your patient comes with a complaint of weight gain, yes, weight reduction would be a challenging thing. Your patient might come with the menstrual irregularity. Now your challenge is to manage the menstrual disorder. Your patient might come with the excessive facial hair growth. Then your challenge would be manage hirsutism. If your patient come with infertility, and she is not aware that she has PCOS, she just come for the very first time and she is saying that I am not able to conceive, then you need to manage the subfertility or infertility. Your patient might come with the problem of acne, now you need to manage her acne. So these are the things you need to consider in your patient. So classically, when it comes to the management of PCOS, we have non-pharmacological options, then we have pharmacological options, then we have, at the last resort, we have surgical option. So the non-pharmacological option is the lifestyle modification, which is the cornerstone of the management of the PCOS, especially in the overweight woman. Even a modest weight loss of 5% can improve her symptoms. Moreover, the weight loss through exercise and diet has been proven effective in restoring ovulatory cycles and achieving pregnancy. So it should be highly encouraged to your patient. For instance, if a patient comes to your clinic and she is not able to conceive, and you look at her and she has BMI more than 30, then absolutely your first step is to work on her weight reduction. Because in any form, maybe it is acne, hirsutism, subfertility, menstrual irregularity, all of these things, if you manage the weight of your patient, these symptoms would a lot get better. Other than that, I just divided one by one. If you want to manage the menstrual irregularity, what are the options? Yes, weight loss is the first line management. Other than that, COCP is the best option. If she is not willing to conceive, then yes, you can go with the COCP. Or other than that, you can use a combination of metformin with COCP. So these are the options for menstrual irregularity. For the symptoms of hyperandrogenism, uh, the first line topical treatment for hirsutism is the topical eflornithine. You can see here, this is the picture. I used to study pharmacology this way, that I used to take the pictures of the different brands of those medicine so that I can have a visual memory. So here you can see hirsutilin, which says it is eflornithine HCl 11.5%. So this is the first line treatment, topical treatment for the hirsutism. Can be used to help with acne and hirsutism. It can be taken. Okay, this is about the spironolactone. First line again, topical fluorinethine, and it shouldn't be given to the woman under 19 years of age or pregnant or breastfeeding women. Other options for decreasing the amount of androgens, we have finasteride or spironolactone. So these are some advanced medicine which we do not routinely used in the treatment of hirsutism, because they required, especially spironolactone, they required regular monitoring because it might lead to hyperkalemia or it disturbs the potassium levels in the plasma. So that's why, and the dose adjustment and the time duration, so everything should be monitored. However, spironolactone can be used to help with acne and hirsutism. It helps with both. The required treatment with spironolactone is 6 to 9 months, and it is not. It is avoided during pregnancy because it might lead to feminization of a male fetus. So this is about hirsutism. Then we can also, in order to decrease the amount of androgens, we can offer COCP as well. It also the patients who just have starting the hirsutism, COCP works very well in them. COCP decreases androgen level and by increasing sex hormone binding globulin. Cosprindiol combines ethyl estradiol and cyproterone acetate, providing a regular monthly withdrawal bleed and beneficial anti-androgenic effects. So these are the different options if you want to decrease the amount of androgen in the body. So these are the medicines, these are the options you can go with. Is everyone clear till now? If anyone have any question, you may ask me. Should I move on to the next slide? Okay. Again, in hirsutism, for here I have talked about the pharmacological approach, but we do have cosmetic approach like non-permanent measures, bleaching, waxing, tweezing, mechanical applicators. And one thing to note that these are the questions some patients would ask you, that does these steps increases the hair growth? So the answer is no. These non-permanent approaches such as shaving and waxing do not worsen hirsutism, so they can follow these steps. Permanent measures are laser or electrolysis. For acne, you can prescribe 1% clindamycin lotion or 2% erythromycin gel. For severe acne, isotretinoin, but it is must be avoided in pregnancy. So this is how different aspects of PCOS you can manage your patient. The last but not least is subfertility, which is the most challenging to treat in PCOS. Weightless alone may achieve spontaneous ovulation. Ovulation induction with anti-estrogenics like letrozole is the first line, or gonadotropins can also be used. Laparoscopic ovarian diathermy, which is a surgical approach. IVF if ovulation cannot be achieved or does not succeed in pregnancy. So these are the options for subfertility. Insulin sensitizers. Meanwhile, we know in the PCOS, in pathophysiology of PCOS, we see that we have excess amount of androgen. At the same time, the challenge was insulin resistance. So how would you come up with the insulin resistance? Again, weight loss. Uh, Advise your patient to cut down carbs and take more and more lean protein. The other thing you can do is the metformin, which is unlicensed in the UK, but it could be prescribed. In those with resistant and ovulation, metformin combined with letrozole or clomiphene citrate improves ovulation and pregnancy rates. Does not significantly improve hirsutism, acne, or weight loss despite lowering androgen level and improving insulin sensitivity. That means if you want to manage hirsutism and acne, you need to follow different measures. Okay. This is the mechanism of action of letrozole. Uh, you can imagine these are the granulosa cells of the ovary. Androgens, here we have aromatase enzyme which converts these androgens into estrogen. And what is letrozole? It is aromatase competitive aromatase inhibitor. So it competitively binds here and inhibit aromatase enzyme, so which would lead to decreased level of androgens. So this is how letrozole works, and it lead to the ovulation. Surgical management is the laparoscopic drilling or puncture of not more than 4 cysts in each ovary, either by laser or by unipolar electrocautery. It is classically reserved for those patients. This is not routinely advised to the patients, but in severe cases, if the medical therapy fails, hyperstimulation occurs in infertile women and previous pregnancy loss, we can take this measure. Okay, so this was all about PCOS. Here is a quick quiz. You have 45 seconds to answer this question. Excellent is the correct answer. This is the biochemistry of PCOS. There would be elevated luteinizing hormone, LH-FSH ratio is increased, FSH could be normal or low. Testosterone, estrogen, prolactin are all typically normal or elevated. Sex hormone binding globulin typically normal or it could be reduced. So in a nutshell, elevated take-home points are elevated luteinizing hormone, LH and FSH ratio more than 2. Normal is 1:1. Okay, I hope the first part on how to book the MRCG Part 1 exam gave you a clear idea and made the process easier for you. And in the second part, I'm sure the discussion on PCOS helps you understand its importance, not only for your exam, but also for your future clinical practice. So thank you so much for your time and active participation. Stay motivated, keep learning, and I wish you all the very best for your exams and your careers ahead. Take care and see you next time.